today we're going to be doing more of the MMI that I sort of missed on the other videos. So I've already done ethics and why medicine, so click on the annotation above if you want to go back to those videos. Today I'm going to sort of just dabble in general theory, how to actually approach the MMI when you get there, because I think it'd be useful to have sort of a strategy on the day and just sort of give you an insight of what it was like, as well as an idea of how to answer a couple of sort of random questions. So on the day, obviously you're going to be nervous. It's sort of unavoidable that you're going to be nervous, but the thing to keep in mind is that, especially with a graduate MMI, you've gotten to the place where you're probably in a very small pool. So it might be 150% of the actual applicants that are going to get in. So more than prove that you're some sort of superstar socialite with amazing public speaking skills, you have to show that you're not a psycho, basically. You have to show that you're not going to be someone that is going to do badly in medicine rather than excel. Having saying that, Monash undergraduate in Victoria, there's like a ridiculous amount of applicants, so you really have to excel. So when you get there on the day, it's going to be it was a really weird atmosphere because everyone comes at once and sits in this theatre. There are not many applicants, maybe 50 odd, and they have two sessions. Now I was unlucky and I was in the second session. I had to wait for nearly 3 hours. So it was at about 1 o'clock and we got there at 9. And being in that group, I've noticed a lot of them got really scattered because they'd obviously built it up, prepared it in their mind that I'm ready, let's go, hit this. And then when they got there, they had to sit there and wait and sort of delve in it and absorb it and get stressed. So if you're in that situation, I recommend going for a walk, get a coffee if you're not too affected by coffee. I hope you're not. I'm basically immune. And yeah, so go through that, have a walk, relax. If you know anyone, I would hang out with them, but I would try not to sort of socialize with the people there, because depending on the uni you came from, I came from Monash and there weren't very many people there, and it's just a personal thing. It's a competition. As much as you want to make out that you're going to be friends and you might meet each other in medicine, look, I'm trying to beat you. I don't really want to meet you for the first time in a situation where I'm trying to beat you. So in a competitive situation like that, I just get away from it. Okay, go for a walk, sort of reassure yourself, have a coffee, go have lunch, do something that's going to take your mind off it, because talking to the people there, if anything, is going to cause you more stress, because they're going to be like, what questions are you going to ask? What are you going to say? How are you going to answer? Do you think that's a good way to do it? All those things just cause more stress and make you do worse, because there's enough pressure as it is, and you don't need all these people sort of adding to that. So I'd recommend going for a walk, taking it easy. Even the day before, I wouldn't bother preparing. Just try and relax as much as possible. I know it's not exactly easy, but it'll make things easier for you. Okay, so what was I going to say? Random other things. All right, so you'll walk up into a corridor with lots of doors, and they all have a written thing on the door. On the door, they'll have the question and information about the question. Your first question is almost guaranteed to be why medicine. Check out my video up there on why medicine. It's a difficult question to answer, but I explain it well up there. But the key sort of insight I want to give you is that the information on the door may or may not be inside, and you have to absorb it. I've said this in other videos. You have to know the information that is given to you. So particularly in the ethics questions, which is another video, they give you a breadth of information, and you need that information to be able to strongly argue whatever point of view you make. And it's relevant to medicine, because if they give you a sheet of tests, results, and you're arguing with another doctor, you need to be able to just snap, argue your point, prove whatever diagnosis you have or what course of treatment is correct. So make sure you get good at retaining information like that. That's very, very, very important. As well as that, try and get an idea of what you're in for once you get in. So if it says it's a video question, which is a very difficult one, basically you'll sit down, okay? Straight away the guy go sit over there. In the corner there'll be a chair and a video. Now this is all time in the time that you're answering. So you've got something like 8 minutes to get all your information, get the video done, and answer like 5 questions concisely, clearly, but also in an extended fashion, and prove to this person that you've done well. So it's not easy. So you get in, when you watch the video, you have to be attentive, alert, okay? You have to pick up every detail. This was my worst question, and the guy actually marked it in front of me. So I saw, as I started, I was saying some really good things. Basically, it was just a video, an ethics video, and these two student doctors were basically personally attacking a patient when he was in the vicinity and he could hear and he was getting upset. And the interviewer said, "What did you see? Explain to me how you saw it, what your thought process was, and moreover, what did you see?" And I said, I felt that their behavior was inappropriate. I saw them fail to wash their hands. I saw them writing superfluous notes. I saw that they didn't even properly assess the patient. They just gave him a passing glance. I see that they're more interested in each other than in the patient. I don't see any senior staff. Like you have to really think abstractly, because if you just watch that clip for about a minute, it really just looks like two people walking around a hospital. Okay? Embellish as much as possible in this one. This is the only one where you can go off grid. If you can think of any cool idea as to what you can pick out of that video, as long as it's nothing that's going to be offensive, it's a great thing. Because I said the one that actually, I saw him scoring it. So I started off with a 4 because I said a lot of good things, and there was something like details from it. Then my thought process, he gave me a 2 because I was just saying stuff. I wasn't actually expressing how I got to that. So I noticed him after the 2, and I was like shit, like big stress came on me. So then I'm like, crap, I gotta like pick this up. So then I said, well, look, I think that they have some sort of negligence because they didn't wash their hands, and hand washing is very important in the medical field. And I think that they need to reassess like their procedure. And he straight away he was taken back because it was a very sort of left of center thing to say, especially considering it was mostly about ethics, what I had been saying. And he instantly crossed another 4 and another 4 because it was something like extravagant detail and something else. 4 and 4. And that made me feel more confident. This was my second question. So going into video questions, my advice is sit down, watch the video quickly, but also really, really concentrate and think about every little detail that has happened, okay? Second, make sure that you really, really embellish. I know that doesn't really sound right, but it is. Embellish all the things that you saw and make sure you explain the thought process that got you there. So I saw them washing their hands badly, the end. Versus I saw them washing their hands and I realized that washing your hands effectively is very important in infection control in the medical field, blah. Okay, that's good. I think, video questions. I'll do another final video on other MMI questions that I've missed so far, but I hope that gave you an idea of sort of what you're in for once you arrive on the day. I forgot to say that they'll show you a little presentation as well, but it'll be information that you mostly know because you would have got it in the information packet anyway, so it'd be expected of you that you know it. So I wouldn't stress too much about the presentation. Just clear your head, go for a walk, don't socialize. There's better times to socialize. Be calm. If you have the long one, read, do something away from it, don't even think about it. And in the video questions, be attentive, embellish, and explain your thinking, okay? So those are my tips for today. Comment, rate, subscribe, all those good things. Thanks for watching, and I hope you enjoy my videos.